Most hospital stays in Saskatchewan last about 7.5 days, but that's not the case for everyone. People experiencing homelessness in Saskatchewan stay, on average, for 22 days. In Canada, the gap between the two is more narrow, 15 days for someone homeless compared with 8 days otherwise. Part of the issue is underlying conditions that have typically gone untreated. The other is housing.
If they do not have a fixed address, it's a little bit more complicated and it takes a bit more time.
Most standard patients can be sent home to mend, but in these cases, the hospital looks for supports to replace those found at home, like family and a consistent bed.
We want to make sure that when the patient is discharged, they're able to access the care and be in an appropriate environment that they remain healthy.
But that's not always possible, and it's up to the patient to access supports lined up for them. Even if there are shelter beds available, they're not always suitable.
If there's someone being released from hospital who still needs help, for example, going to the washroom, we don't have the staffing and the ability to help with that type of thing.
Taylor says hospitals are one of the mainstreams for people coming to the shelter. The answer, he believes, is more supportive housing. Until then, he sees no alternative available right now. The 75-bed Saskatoon shelter has been hovering at capacity since winter, and city hospitals have been dealing with overcapacity for years, but neither is an ideal space for someone recovering from a hospital stay.
Well, until a solution's found, what else are you going to do?
Dane Patterson, CBC News, Saskatoon.